Doctors of Reddit, what was the worst thing you've seen for a patient that another doctor overlooked?
No, really. So this one guy was brought in with an ambulance for upper airway obstruction. We diagnosed what looked like an advanced throat cancer and did a tracheostomy. After the operation, where you pull and push the neck like crazy, we checked his neck x-ray and a junior asks when did he break his neck. He had a brand new unstable neck fracture. Checking his initial x-ray, we see that it was there prior to the operation. After questioning the patient, he said that on his way to the hospital, the ambulance was in a car crash. No one bothered mentioning it to us when he eventually came in. He only thought he had some whiplash, but he was a few millimeters away from permanent paraplegia. Unfortunately, he passed away about 2 weeks later due to the cancer. My husband had a weird dimpled spot on his back. Went to the dermatologist multiple times, was brushed off, and told not to worry about it. Derm even burned off a nodule that was bothering him at his belt line, but repeatedly said it was nothing and was visibly irritated with us for being anxious. We waited for nearly 10 years before going to another dermatologist, since our experience was so negative. Next derm immediately diagnosed what turned out to be a sarcoma which had 10 extra years to grow. My husband now has a 48-inch scar snaking down his back from the removal of the tumor and the reshaping of his back. I now have months of experience with wound drains, tunneling, bandages, triage, and the laundry that comes with massive wound healing. I would like to take that first dermatologist who was so fucking patronizing with our concerns and shove his face deeply into his own ass. I suppose I have one for this as a resident doctor. We saw a kid in the emergency for difficulty walking. He had been slowly losing the ability to walk over months and also had random unexplained projectile vomiting episodes. Looking at his records, he saw his doctor several times who x-rayed one hip, then the other hip, gave some Zofran, etc. Turns out on exam he is blatantly ataxic, bad coordination, and can't even stand. Failed all our bedside neurological examinations for cerebellum function. It was obvious to me, and I'm not even good at this yet. Did a CT scan. Big-ass tumor in his cerebellum. It was obstructing fluid drainage in his brain too, raising his intracranial pressure and causing the vomiting. Had to call in the neurosurgeons overnight for emergency drain, and he went to ICU. Later had more surgery for the tumor. My supervisor got pretty emotional about it actually. My best friend was in her late 20s and was feeling constant irritation in her stomach. She went to see several doctors over the course of almost 3 years, and they all dismissed her saying she had an irritable bowel. She would try a new diet every few months, but nothing helped. One day she calls me and tells me she broke her ribs. She didn't know how it happened, but she started having horrible pain and her doctor said her ribs must be fractured. Long story short, it wasn't fractured ribs. At some point when the pain became too much to bear, she went to the ER and got a CT. Turns out she had stage 4 colon cancer with 4-inch tumors in her abdomen that were compressing her organs and causing the pain. She died a few months later. She'd been seeing doctors about her symptoms for 3 years. If one of them had taken her seriously and sent her to get a colonoscopy, she'd probably still be alive. I'm the patient, but it's an important story to tell. From the age of about 17, I start getting regular abdominal pain every day and terrible gut problems. I can't seem to eat much anymore. I get fluctuating diarrhea and constipation. Menstruation gets more and more painful. I start losing enormous amounts of blood despite being incredibly small, less than 5 feet. Now you would think any doctor worth her salt could figure out it's a gynecological problem. But my doctor, a woman by the way, at the time insisted anxiety and says she wouldn't bother testing for or treating a gynecological problem unless I was older and having trouble conceiving. Over the next few years, my gut and uterus symptoms slowly deteriorate. I get bounced around the system to dozens of different specialists. I get told it's just stress, anxiety. Are you pregnant? Are you Sue or you're not pregnant? Every woman has painful periods. It's just constipation. Take this over-the-counter product, etc., etc. Meanwhile, my gut function slowly grinds to a halt. A functional gut test took 6 hours to pass an egg sandwich when it should have taken 90 minutes. I weighed only 40 kilograms. It gets so bad I even start losing bowel control. No treatment seems to work. I was 24 and unable to work because I was literally uncontrollably **ting my pants. Doctors suggest I should maybe seek therapy and suggest I could be exaggerating. Anyway, one day I see a new GP for some regular sexual health tests, but get an abnormal pap smear. Within 2 weeks, I go in for an exploratory laparoscopy to rule out cervical cancer, only to discover I am absolutely riddled with endometriosis. On my bowel, on my cervix, on my perineum, on some ligaments. Ovarian cyst the size of a tennis ball. It was even in my gallbladder. With Excisions Plus treatment, I had my gut function back within 3 months. I will never be able to have children. If that woman when I was 17 had just done her goddamn job, I wouldn't have lost 7 years of my life. My gallbladder, my fertility, and my mental health. Not a doctor, but I had a half-assed dentist. I went to a dentist's office for several years and was repeatedly told to get braces and have my wisdom teeth removed. Both of these pose an issue, since I play trumpet for a living, and performing at a professional level is difficult to impossible with braces, and having wisdom teeth out would put me out of work for at least a month during recovery. The dentist was told this repeatedly, during every visit. I decided to get a second opinion about the wisdom teeth, so I went to an oral surgeon to have them look at it. They took x-rays and looked at the records from my dentist. Then the conversation. Oral surgeon: so, you're experiencing a lot of pain in your wisdom teeth, according to your record. Me? I am not. At all. I never have. Oral surgeon: so, I'm just going to assume your regular dentist falsified the rest of your record too, so I can put this folder down and do my job. He then went on to explain that the way my wisdom teeth came in, they're sitting on a nerve that's next to impossible not to cut in the process of removal, which would leave me without feeling in the lower half of my face for the rest of my life. As you might imagine, this would also be a major issue, given my career. I was advised that if they're not in pain, not to worry about them. I do need to extract an adjacent tooth to one of my wisdom teeth, though, which my regular dentist completely blew off when I asked about it. I never went back to my regular dentist, and will be starting with a new one soon. I'm not a doctor, but a RN. This happened to me, but isn't nearly as bad as most of the stories on here. When I was in college, I got to where I couldn't swallow. It started with difficulty swallowing, progressed to me having to swallow bites of food multiple times / regurgitating it, and then got to where all I could swallow was broths and mashed potatoes with no chunks. I went to the doctor multiple times, and was told every time it was acid reflux and part of my anxiety disorder. I lost 30 pounds, was only 120 when this started, and was just generally miserable. Finally, my grandma was tired of watching me be sick all the time, so she called the GI doctor herself. They said we needed a referral, but she explained the situation and they got me in the next day. Did an endoscopy and my esophagus was 95% occluded at the gastroesophageal sphincter. For some reason, some of my primary doctor's notes ended up in my discharge paperwork. I guess they had to contact her to get my information, and she had told them it was acid reflux and basically I was being overdramatic. She stated she did not recommend them to do the procedure. Needless to say, I switched doctors. Fuck that bitch. Was not a fun year. Not a doctor, but when I was 16 I was studying to be a nurse, and I got sent on a shadowing / work experience to a nursing home. The worst thing I've seen overlooked is loneliness. There was a resident. I'll call him Mr. R. I had a little free time on my second day, so I went exploring to try and learn the lay of the land. On my walk, I glanced into one of the rooms which had their door open and see the resident inside coughing. and spitting up phlegm on his own shirt because he had nothing else to cough into. I run and get him a box of tissues. While he's wiping himself down, I sit opposite him, waiting in case he needed anything else of me. He sees I'm new. He thanked me for the tissues, and we began talking about the pictures in his room. He told me his life story, about his time in the army, how he met his wife, about how he missed traveling to Sweden every year, all the dogs he'd had throughout his life. He was the first person to talk to me in a friendly manner at the placement, and I really enjoyed chatting with him. He was funny, smart, and overall just a nice person. He had lived a long and interesting life, and since he had no children, it had been a while since he had spoken to a teenager. After about 20 minutes, a member of staff knocked on the door and told me I was needed. I said goodbye to Mr. R and promised to visit him again during my stay. I thanked him for making me feel so welcome, and he thanked me and began to cry. He said no one had ever done that for him. Mr. R had been at the home for 3 years. In all that time, no one had just sat down and talked to him, asked him questions, and genuinely listened to him, made him laugh, made him feel heard. I ended up making several formal complaints and inquiries about multiple problems I witnessed and encountered. Manhandling, neglect, unclean environments, belittling language towards residents, and a general lack of care was just a few. It was the first time I had ever been both so heartbroken and angry. As a caregiver, one of the fundamentals is that you have to care, and for one reason or another, those staff had forgotten. There were a lot of things I saw at that placement that I will remember for the rest of my life, but the hanging feeling of isolation was the worst. And that's it for today's video. I hope you liked it, and don't forget to comment with a similar anecdote or experience related to the video's topic. Leave a like, share the video if you enjoyed it, and lastly, don't forget to activate the notification bell so you don't miss any of our daily videos. Ciao!